Heart arrhythmia symptoms and causes. An arrhythmia of the heart, arrhythmia, is an irregular heartbeat. An arrhythmia of the heart happens when the electrical signals that tell the heart to beat do not function properly. The heart can beat too quickly or too slowly. Alternatively, the heartbeat pattern may be irregular. A fluttering, thumping, or racing heartbeat is an example of a heart arrhythmia. Some cardiac rhythms are completely innocuous. Others may induce potentially fatal symptoms. There are instances when having a rapid or slow heartbeat is acceptable. The heart, for example, may beat quicker during exercise or slower during sleep. Treatment for heart arrhythmias may include medications, devices such as pacemakers, or a procedure or surgery. The therapy goals are to manage or eliminate rapid, slow, or otherwise irregular heartbeats. A heart-healthy lifestyle can help avoid heart damage, which can lead to arrhythmias. Types. In general, heart arrhythmias are grouped by the speed of the heart rate. For example, tachycardia, tachycardia, is a fast heartbeat. The heart rate is greater than 100 beats. Bradycardia, bradycardia, is a slow heartbeat. The heart rate is less than 60 beats a minute. Fast heartbeat, called tachycardia. Types of tachycardias include atrial fibrillation, AFib. Chaotic heart signaling causes a rapid and coordinated heartbeat. AFib may be temporary and start and stop on its own. But some episodes may not stop unless treated. AFib has been linked to stroke. Atrial flutter. Atrial flutter is similar to AFib, but the heartbeats are more organized. Atrial flutter also is linked to stroke. Supraventricular tachycardia. This broad term includes irregular heartbeats that start above the lower heart chambers, called the ventricles. Supraventricular tachycardia causes episodes of a pounding heartbeat that start and stop suddenly. Ventricular fibrillation. Rapid, chaotic electrical signals cause the lower heart chambers to quiver instead of squeezing in a coordinated way. This serious problem can lead to death if a regular heart rhythm isn't restored within minutes. Most people with ventricular fibrillation have an underlying heart disease or had a serious injury. Ventricular tachycardia. This rapid, irregular heart rate starts with faulty electrical signals in the lower heart chambers, called the ventricles. The rapid heart rate doesn't let the ventricles properly fill with blood. So the heart may not be able to pump enough blood to the body. Ventricular tachycardia may not cause serious problems in people with otherwise healthy hearts. In those with heart disease, ventricular tachycardia can be an emergency that needs immediate medical care. Bradycardia is a slow heartbeat. Bradycardia is defined as a heart rate of less than 60 beats per minute. However, a low resting heart rate does not always indicate a problem. If you are physically fit, your heart may be able to pump adequate blood to your body with fewer than 60 beats per minute. You may have bradycardia if your heart rate is slow and your heart isn't pumping enough blood. Bradycardias are classified as follows. Sinus infection. The esinus node regulates the heartbeat. If the node malfunctions, the heart rate may alternate between being too slow and too fast. Scarring at the sinus node can produce sick sinus syndrome, which slows, interrupts, or stops heartbeat impulses. The condition is particularly common in older people. Conduction sty. A blockage in the electrical circuits of the heart can cause the signals that trigger heartbeats to slow or halt. Some blocks may not produce any symptoms. Others may result in skipped or delayed heartbeats. If your heartbeat is abnormal, schedule a health checkup with a cardiologist. If you experience chest pain, shortness of breath, or fainting, seek emergency medical care. If you suspect a heart attack, call 911 or your local emergency number. If ventricular fibrillation occurs, provide hands-only cardiopulmonary resuscitation, CPR, until medical help arrives. If an automated external defibrillator, AED, is available, follow the instructions and use it to restart the heart. Call 911 or your local emergency number if necessary. Causes. To understand the cause of heart arrhythmias, it may help to know how the heart works. How does the heart beat? The typical heart has 4 chambers. The 2 upper chambers are called the atria. The two lower chambers are called the ventricles. The heart's electrical system controls the heartbeat. The heart's electrical signals start in a group of cells at the top of the heart called the sinus node. They pass through a pathway between the upper and lower heart chambers called the atrioventricular (AV) node. The movement of the signals causes the heart to squeeze and pump blood. In a healthy heart, this heart signaling process usually goes smoothly, resulting in a resting heart rate of 60 to 100 beats a minute. But some things can change how electrical signals travel through the heart and cause arrhythmias. They include a heart attack or scarring from a previous heart attack, blocked arteries in the heart, called coronary artery disease, changes to the heart structure, such as from cardiomyopathy, diabetes, high blood pressure, infection with COVID-19, overactive or underactive thyroid gland, sleep apnea, some medicines, including those used to treat colds and allergies, drinking too much alcohol or caffeine, illegal drug use or drug misuse, genetics, smoking, stress or anxiety, risk factors. Things that may increase the risk of heart arrhythmias include coronary artery disease, other heart problems and previous heart surgery, narrowed heart arteries, a heart attack, heart valve disease, prior heart surgery, heart failure, cardiomyopathy and other heart damage are risk factors for almost any kind of arrhythmia. High blood pressure. This condition increases the risk of developing coronary artery disease. It also may cause the walls of the left lower heart chamber to become stiff and thick, which can change how electrical signals travel through the heart. Heart problems presented, also called congenital heart defects. Some of these problems may affect the heart rate and rhythm. Thyroid disease. Having an overactive or underactive thyroid gland can raise the risk of irregular heartbeats. Obstructive sleep apnea. This condition causes pauses in breathing during sleep. It can lead to a slow heartbeat and irregular heartbeats, including atrial fibrillation. Electrolyte imbalance. Substances in the blood called electrolytes help trigger and send electrical signals in the heart. Potassium, sodium, calcium and magnesium are examples of electrolytes. If the body's electrolytes are too low or too high, it may interfere with heart signaling and lead to irregular heartbeats. Some medicines and supplements. Some prescription medicines and certain cough and cold treatments can cause arrhythmias. Excessive alcohol use. Drinking too much alcohol can affect electrical signaling in the heart. This can increase the chance of developing atrial fibrillation. Caffeine, nicotine or illegal drug use. Stimulants can cause the heart to beat faster and may lead to the development of more serious arrhythmias. Illegal drugs, such as amphetamines and cocaine, may greatly affect the heart. Some may cause sudden death due to ventricular fibrillation. Complications. The type of heart arrhythmia determines the complications. Heart arrhythmias can lead to the following complications. Blood clots can cause a stroke. Failure of the heart. Unexpected cardiac death. Blood thinners can reduce the risk of stroke caused by atrial fibrillation and other heart arrhythmias. If you have a heart arrhythmia, consult a doctor to see if you need to take a blood thinner. Treatment to control the heart rate may help the heart work better if an arrhythmia is causing heart failure symptoms. Complications. The type of heart arrhythmia determines the complications. Heart arrhythmias can lead to the following complications. Blood clots can cause a stroke. Failure of the heart. Unexpected cardiac death. Blood thinners can reduce the risk of stroke caused by atrial fibrillation and other heart arrhythmias. If you have a heart arrhythmia, consult a doctor to see if you need to take a blood thinner. Treatment to control the heart rate may help the heart work better if an arrhythmia is causing heart failure symptoms.